Welcome back to your Wednesday edition of the Now Morning Show, where we continue to give you things to add to your calendar. This one being July 14th, when the Mount Hope Health Fair will be coming to the Mount Hope Secondary School, and you definitely want to be a part of it. Joining us again to update us on all of the activities of the health fair is Dr. Jevon Rush, the medical practitioner attached to the urology department of the Arima General Hospital. Good morning and welcome back.
Good morning, lovely to be here.
Always good to have you on set because we know it's things that we could utilize and almost immediately put into action. So this year, this time around, this is what, the fourth?
This is probably the fifth or sixth. Yeah. So we've been going at it at a consistent pace. We're really trying to build that momentum and get Trinidad involved in their healthcare.
So the 14th, it's a whole day situation, just as it usually is?
Yeah,
or are we seeing any difference to time, location, and date?
It's generally around the same time period. This specific health fair would be from 9 a.m. to 2 p.m. And as you mentioned before, it would be on Sunday, the 14th of July, which is not this Sunday, the following Sunday.
Right.
And it would be hosted at the Mount Hope Secondary School. And this is actually an effort that is combined partly by the Honourable Member of Parliament, Mr. Terence Hilal Singh, as well as, the Seventh-day Adventist Hospital, specifically the Sawa and the Mount Dore division this time.
Right. They continue to put emphasis on making sure that help is given to the communities in which they operate, and that's a beautiful thing. But when we talk about the communities that they are operating in, we could talk about the country altogether, because we just came off of that hurricane watch and adverse weather generally this time of year.
Definitely.
One of the things I wanted to focus on was the first aid demonstration and CPR certification, because those will certainly come in handy should any sort of disaster happen. Tell me a little bit, in addition to this particular offering, of some of the other services that are offered.
So what I'll start by saying is that I know a lot of Trinidadians think God is a Trini, and we've been spared this time again. Hallelujah for that. But in terms of how we could be prepared, besides actually getting your goods, your canned foods, and your batteries and whatnot, you need to be first aid aware, and even better than that, if you could be first aid certified, right? And the way I want us as Trinidadians to look at first aid is essentially, besides being able to act upon an event or a situation, we need to be able to identify the situation, right?
Beautiful.
Part of the process and part of the pathway as well is knowing how to refer the patient appropriately, meaning that if you have a situation, I want it to be able to act, which is where the first aid comes in. But I don't want it to act, and then if the situation resolves or if the situation calms, you just put your hands up and say that's the end of the road. You need to be able to be aware that, okay, this person needs to be transferred to a hospital, or this person could do by going to a health center. So definitely this time around in the hurricane season, the first aid and CPR demonstrations that we are going to be providing on Sunday the 14th, that is relevant to everybody. I would say everyone from approximately the age 7, 8 upwards, right? Because we have, Trinidad is a mixed population in terms of age, and we have a lot of young kids living at home with elderly persons as well. So we want those young kids to not be able to specifically administer the CPR, but again, be able to identify emergencies and threats.
That's a very valid detail to underscore, being able to identify it, and escalators needed. Now, we do have the more commonplace things that the health fair offers, like the pap smear tests and the prostate examinations. Will we be seeing any additions to this long list, perhaps, for that location?
So for this location, and as previously, we are really trying to keep that head-to-toe approach. We want to provide holistic services, demonstrations, and products for the population. So starting from the head, we're doing things like vision testing. We're also doing your lung function testing, stroke risk assessment. For the ladies specifically, we're going to have the breast exams and the pap smears. And as everyone in Trinidad knows by now, once you see me, we're going to talk about your prostate health as men, right? But we're really aiming to provide a wide spectrum of services, because we've realized in Trinidad, look, a lot of our population are diabetic, a lot of them are hypertensive, and diabetes and hypertension form the foundation for so many complex diseases, right? We have a large amount of persons in Trinidad being affected by things like diabetic feet. And if you yourself know someone with a diabetic foot, it is a very complicated disease, and one in which the outcome could possibly be death. So the odds are very, very great in this game specifically.
Right.
Yeah, so definitely, again, we're trying to give a broad spectrum of services to Trinidad and Tobago.
I noticed that the vaccines are also offered, so we need to work with our vaccination cards, yes?
We would definitely appreciate it. We are completely aware that some persons by now may not have the vaccination card or they may have lost it.
Right.
So we are prepared to furnish you with a new one. We don't want that to be a deterrent. We want you all to come forward, get your vaccinations. And I'm very happy that you spoke about vaccinations, because there's a vaccine that a lot of persons in Trinidad, they're not very familiar with, and that's actually called the HPV vaccine. And HPV stands for the human papilloma virus, and that is actually a virus that is closely linked to cervical cancer. Now, the thing is that once a lady or a woman becomes sexually active, she is at risk of developing or contracting a HPV virus. If we're able to prevent and put a wedge in that process, we're able to severely reduce the amount of cervical cancer cases we're seeing. So again, we're pushing these vaccines out at the public.
Makes sense. I know that the general excuse me, I know that generally the experience is that there will be some counseling before and after the issuance of any sort of vaccine.
Yeah, definitely.
But particularly with this one, we would want to get more information moving forward. So where can we connect digitally, at least, to read through all the brochures and pamphlets that we will probably hold on to at the health fair?
Yeah, so besides at the health fair, we're going to be having all of this information on the Ministry of Health, as well as so as I mentioned before, or I may not have mentioned it, but the Community Hospital of the Seventh-day Adventists is a large provider in this endeavor. And they are a faith-based hospital, but they are also large or big on lifestyle, right? So lifestyle, besides the changes, a lot of the work is about educating the public. So definitely, the persons can feel free to go on the community hospitals' websites, as well as we urge you all to pass in. Yeah?
Definitely the method that a lot of people will utilize. And all of this being done for free.
Definitely 100% free.
The best part of it, actually. Now, that means you have a lot of partners in this endeavor. Anybody you wanted to say thanks to outright this morning?
Definitely. As previously mentioned, the Community Hospital of Seventh-day Adventists, they have been mammoth in this endeavor. We also would like to bring my hometown in, which is the North Central Regional Health Authority. Northwest Regional Health Authority have also been large players. We also have people from the QPCC, which is the Queen's Park Counseling Center. We have persons from the Dalton Optometrist as well, and even people from the Stroke and Diabetes Center coming in. So it's an amalgamated approach, and we see a lot of persons putting their interest in Trinidad's health.
Beautiful stuff. Now, one other thing I wanted to double check on, because you've mentioned it before in terms of knowing your numbers. You do a lot of blood pressure, glucose level, and cholesterol testing at these health fairs. How has the reception been to that? Because you've stressed it before, but I mean, you can reiterate. Are people responding positively to knowing their numbers?
So I would say definitely yes. And I'll give a example that I hope can motivate a lot of Trinidadians and persons looking at this program this morning. So at one of the previous health fairs, approximately 3 to 4 months ago, I'd have encountered a lady that she wasn't aware that she was diabetic. When we checked the blood sugar via the finger, the level was unreadable, which is extremely high. We then followed up by doing the diagnostic diabetes test, and that also came back unreadable. I reviewed this patient approximately a week ago, and their blood sugars were completely normal. When we did the diagnostic test, they were actually within pre-diabetic ranges. And this person was able to accomplish this by largely lifestyle changes, as well as the lower end of the spectrum of medication as well. We didn't have to be very aggressive with our management. Right? So that kind of ties into, there's a physician-tailored and research-proven lifestyle change program called New Start, and it's NEWSTART, right? And that's an acronym, and it stands for nutrition, exercise, water. We want to have sleep, we want to have temperance, we also want to have rest, we want to have exposure to air, right? And those factors and those things, once we incorporate them into our holistic healthcare, we're able to slow some diseases down. We're also even able to reverse some diseases. So again, I don't want a lot of Trinidadians thinking, okay, they're going to go to the doctor, they're going to be administered medication. We as physicians are taking a step back and approaching this at a more holistic level, right?
and a holistic approach in terms of the offering of services for free at this edition of the Grand Health Fair, brought to you by the Member of Parliament for St. Joseph, the Honourable Terence Singh, and of course the Mount Sour Seventh-day Adventist Churches. Thank you very much, Dr. Rush, for making the time this morning to join us, updating us on all of these specifics and giving us a new start, if you will.
It's always my pleasure.
Best of luck, but you guys can head on over on the 12th of July to make sure you explore all of the free services offered. And for now, we take a break, come back with more that you want to add to your calendar here on the Now Morning Show.